Hey guys, welcome back. Today I wanted to explore with you the importance of nuclear scintigraphy in the diagnosis of hyperthyroidism. Here I have two cats. One has a T4 of 3.5 and the other has a T4 of 5.1. One is hyperthyroid and the other is not. You may be like, well, this is kind of obvious. The one with the T4 of 5.1 is the one that's hyperthyroid and the one with the T4 of 3.5 is not. But it's actually the contrary. And I see this a few times a year where you have patients with a normal T4, but they're still hyperthyroid, as this cat right here, who has a right thyroid adenoma, which is kind of, decent in size, especially for a T4 of 3.5. On the other side, we have a cat with a T4 of 5.1 that does not have hyperthyroidism. It just has a slightly increased T4, and that's just normal for that cat. And the way you diagnose this is by comparing the uptake of the thyroid versus the salivary glands. And for a diagnosis of hyperthyroidism, you want to see an increased uptake in the thyroid glands in comparison to the salivary glands, which we have here and we don't have here. Here, the salivary glands are much more evident than the thyroid glands, and thus no hyperthyroidism. And it's really important to emphasize that nuclear scintigraphy is the gold standard test for diagnosis of hyperthyroidism. There's no better test. And the reason for that is that it looks at what the thyroid gland is actually doing, which is what matters. You'd hate to not treat a cat with I-131 that is already hyperthyroid, but more importantly, I definitely don't want to treat a cat that's not hyperthyroid with I-131 or with methimazole or YD diet for that matter, right? You don't want to treat a patient that doesn't need treatment and running the risk of making them hypothyroid, especially with conventional I-131 therapy where 70 to 80% of these cats will become hypothyroid. So I thought I'd share this with you. Hopefully this can be some value to you. And I'll see you next time. Thank you.